I'm Dr. Jean Chou from St. Justine Hospital. 1 out of 100 patients has celiac disease. Celiac disease is an autoimmune condition that affects children and adults. The diagnosis of celiac disease relies on endoscopy with biopsy of the small bowel, mainly the duodenum. European guidelines have been published in 2012 and revised this year, and for children with symptoms that can bring to the diagnosis of celiac disease, the European guidelines state that we can rely on the level of anti-transglutaminase antibody, IgA, more than 10 times the normal, and antibody anti-endomysium. So if a kid has clinical symptoms, this level of anti-transglutaminase and endomysium elevated, the diagnosis may be made. So no need to perform endoscopy. However, in Canada and in US, this statement has not been endorsed. We still perform endoscopy in children for the diagnosis of celiac disease. In a previous work that was published last year by our student Nguyen Tam and others from our lab, we have shown that in St. Justine Hospital, we use a kit Innova Diagnosis Cantalite. With this kit, we have demonstrated that a level of IgA more than 10 times normal alone, without any analysis of anti-endomysium, was quite accurate for the diagnosis of celiac disease. All patients with more than 10 times the normal in our center had a confirmation of celiac disease on the biopsy. So this work was aimed to see if in those patients who had endoscopy, the endoscopy might bring additional diagnosis, both macroscopic diagnosis and histologic diagnosis. So we analyzed our cohort of 405 patients diagnosed between 2011 and 2018. Among them, 58.7% had the criteria of more than 10 times normal of the IgA anti-transglutaminase antibody. As you can see, the median age was 8.4 years. We had slightly more girls than boys, 67% of girls. So what did we find during that study? All of the patients had histological abnormality. Most of these were total villus atrophy or partial villus atrophy. So the diagnosis of celiac disease was clear. We found some information in the endoscopy, specifically non-specific gastritis that was present in 24.4% of patients. We found some cases of eosinophilic esophagitis, 1.2% of cases, and peptic esophagitis in 4 patients. 2 cases of Helicobacter pylori were identified in this cohort. But the vast majority of abnormality in the endoscopy were related to celiac disease. For example, mosaic pattern, as you can see here, we have in the bulb those fissuring of the mucosa. We can find a erosion or some ulcer on the bulb or the duodenum. So we can conclude that apart from the classical features associated with CD, the supplementary diagnostic yield of the endoscopy was very low. So in view of our results, we believe that we can confirm the diagnosis of celiac disease with only clinical symptoms and level of anti-transglutaminase antibody more than 10 times the normal. These are research results. We are not yet on the practice of changing how we do things. The first and very important step will be to normalize all the different kits of analysis that are available in Quebec, because we have seen very different results from one center to other. So we cannot yet put in practice these results, but we are aiming to try to bring something that could enable us to save nearly 50% of endoscopy in children. Thank you.